Hello. Hello.
Hi, madam.
Sorry.
I just send you patina. Nothing
Good evening. Good evening. How are you?
We are fine.
Hello. Okay. Thanks for your consent. Thanks for the other day. I am fine. Thank you very much.
So man, I just send my feedback.
Who is stepping? Oh,
that has always been the
okay. So let's go through developing therapeutic communication skills in nursing and midwifery. Have you done this one? We are not done that. Have you done therapeutic communication skills? No. Hello, are you there? Hello.
Hello. Madam, we can hear you, please.
Have you done this? So let's go through therapeutic communication skills. We have done the styles. We have done the constructive criticism. So let's go to the skills. So upon completion of this lecture, you identify ways to improve your communication with patients, develop listening skills, describe how to become an active listener, and model out listening skills. You also have to outline the various techniques used to improve listening skills, explain the purpose and types of interview, understand assertive skill within the assertive skill in the therapeutic communication style. Outline tips for presentation success, explain how to communicate effectively across an integrated network. So what is therapeutic communication skills? As I said, we've already done the styles. Now, what are the skills? So the skills, also developing these skills is very crucial. It's a crucial component of nursing and midwifery, and it's dynamic and complex concept. And it plays a very crucial or significant role in nursing education and nursing practice. And communication, we go through the forms. So communication in all forms, including nonverbal communication, it needs to be worked at and improved to ensure you understand. So just you understand people and they also understand you. Just as earlier on I said that your communication style, you also need to learn. So in the learning process, you also want to learn these skills, even though some of you may possess the skill, but you also need to also learn to be conversant with any of the various skills that we have. So what is it? What are good communication skills? Good communication skills are the abilities that assist you to become what? Effective at sharing information with others. Why some communication skills, it's, as I said, it's some you can have it naturally. As you say that leadership are born, leaders are born and some whatever. So some possess it naturally, but others, you need to develop other essential skills to be able to leave a mark on the people with whom you converse. Yes, so even though it might come naturally, you can also work at it to improve upon it. So what is important of good communication skills? It enhances patient care and safety. So clear and compassionate communications help healthcare professionals provide accurate information to a patient and even patient relative, and even our peers. And it ensures that they understand their condition. Yes, before you be able to help patients to understand their condition, you need to have this good communication skills. So if you have these communication skills, as I said, it can enhance patient care and safety, because this one, if you do it, it ensures they understand their communication, their treatment options. If we exhibit good communication skills and medication or instructions, and thereby it can also prevent medication errors. It reduces medication errors by ensuring accurate documentation if you have that kind of skills. So because you have written skills, oral skills, and information exchange. It's also effective team collaboration. Strong communication fosters teamwork among nurses, doctors, and the like. and this can lead to improved patient outcomes and patient safety. And it's built trust with patients. So active listening, active listening is a part of also communication skills. And empathetic response, putting your shoes in others to be able to feel what they are going through. So empathetic responses help patients feel valued, it feel respected, and it brings that kind of belongingness, being there with the patient, and confidence in their care. Or it's also encourage open discussions about symptoms, concerns, and treatment plans. And it's also important in leadership and decision making. So when you get to management, you know what leadership is about. So nurse managers and healthcare leaders must communicate clearly to inspire, motivate, and guide their teams and where team members and team groups. It can also help in what conflict resolution. So when you involve patients in their healthcare, it helps in prevent some conflict. So delegation of tasks. When you are a leader, so leader, you need to delegate what tasks. You cannot take all the things. You also need a good leader must delegate. But if you are delegating, it must be appropriate and effective. When you also delegate, you also need to supervise and monitor. It leads to teaching and mentoring in nursing education, essential for training. Yes, the skills, good communication skills is very important in training and educating nursing students, junior nurses, our mentors, and everybody that they are in the healthcare team. It helps in simplifying complex medical information for patients, students, and even amongst us. Managing crisis situations. So in emergencies, quick and precise communication ensures rapid response and coordination among the healthcare team. And it also helps in patient education and health promotion. So what are some of the examples of poor communication? We have dealt with good communication. What are examples of poor communication? And in our workplace, ineffective communication that is not effective, it can lead to what? Misunderstanding. It's not even our workplace, even amongst ourselves, in our family, in our daily communication with our family. If you don't take care, there can be confusion and misunderstandings. Yes. So it prevents, it can lead to complex. So as I was saying, it's lack of clarity and vagueness. Our communication should not be vague. It should be simple and should be clear. Example, the supervisor tells the nurse, handle the patient issues without specifying the problem or expected actions, and it can lead to confusion and delays in care and potential errors. So, as I said, it should be clear. We all learn. So this is a poor communication. It should not be vague, but it should be simple and clear and to lead the people as to what they are supposed to do specifically. And active listening is very important, involving all your senses. It means that you are participating and you know when you listen, you will not miss any part of the conversation that you are having. So, example, a manager interrupts a staff member before they finish explaining a concern. Employees feel what sometimes you miss some of the important points. So, active listening without interruption and important details may be overlooked. Ignoring feedback or concerns. So if you keep on ignoring every information you also need, as I read it, the communication process or cycle, there's also what the last point is what feedback. And feedback is very important. Yeah. Example is a nurse expressed concern about patients, but the team leader dismisses it without what investigation. You need to investigate it to get the feedback, to get the actual problem. So this one, it can create distrust, reducing morale, and increases the risk of mistakes. Using negative or aggressive language, as we did last time, we have what? And being aggressive, as I said, aggressive is not good. You always make mistake and with documentation. Do you even know what you are doing? It doesn't speak well. You could have that, make it an assertive thing so that you all come on the same page. So it can cause workplace tension, lowers confidence, and discourages teamwork. Inconsistent messaging. This is an example of poor communication. Then over-reliance on written communication without what? Clarification. And sometimes too, medication errors can happen because there is no clear written information, documentation. Sometimes you need a doctor's handwriting. Sometimes it is very bad. You cannot see what is actually written there. So when you are there with them and when they are not sure, or you need to also what? Let them clarify what they actually mean. So, example, sending an unclear email about a policy change without what? Allowing staff to ask questions where they are not what? They are not clear, when they are confused, when the message is vague. Let them ask questions to clarify what you actually mean. So it increases what? Misunderstanding and delays in presentation. Gossiping. And you were not employed to what? Gossip. You were not employed to gossip. So gossiping and workplace rumors. Employees spread false information about leadership change instead of seeking official word communication. It creates a toxic work environment. You know, when there's a toxic work environment, things are not going. It is also bring about what? Unproductivity. So it creates a toxic work environment and damages professional relationships. Lack of follow-up. And its employees feel neglected, leading to frustration. Supervisors promise to address a staff concern, but never follow up. It doesn't speak well of you. So how do we improve workplace communication? You need to be clear and direct. You need to encourage active listening. Active listening is allowing the employees to express their consent, foster a positive communication culture where you use respectful and constructive language. So you need to be honest in the ensure consistency in message. Then provide opportunities for feedback. And these are the strategies to improve communication in healthcare setting. You need to, as I said, foster a culture of open communication. And this one, it encourages staff to express their concern. Then you share your feedback. And as a feedback, when you don't share a feedback, it brings about staff morale. And ask questions without fear of what criticism. And we need to be what? Implement an open door policy where employees feel comfortable approaching leadership. You need to embrace them. You need to have a good relationship, good communication, work relationship without creating that kind of what toxic environment. Toxic environments. It will not help the organization to grow. When every person, I quite recently, somebody shared an information. It said this person, when she was our head or our leader, the leader would not speak to a lot of the employees, and there was this tension in the environment. And this when you do that as a leader, you are not in good speaking term with your staff, things will not go on well. Or say, oh, this when you change this person and this person came, oh, this time we are working, we are happy. He has a good relationship. We have feedback, we have open communication. But the other person, he wouldn't mind, we didn't care whether you are, and she didn't even talk to us. So we had that kind of poor relationship. And it's all boils down to what? For organization. And when you use this kind of strategy, our objective, our aims will not be achieved. So it is very important to establish this kind of open and honest relationship. So, as I said, you need to implement an open door policy where employees feel comfortable approaching leaders. Conduct regular staff meetings to address concerns and what? Provide updates. Example, a nurse raises a safety concern about medication administration. So instead of dismissing it, the manager investigates and implement changes to what? Prevent errors. So that is foster a culture of open communication. Practice active listening. Give full attention when a colleague or a patient is speaking. So you can use verbal and non-verbal cues. That is nodding, maintaining eye contact. This shows that you are engaging. And the engagement here is very crucial. So it is disheartening when you see that you are making an effort to talk and the people are not engaging. So summarize and repeat key points to confirm, understand. The patient expresses confusion about their medication. The nurse actively listen, repeats the instruction and clarifies the concern, and do whatever the patient is looking for or seeking for. Standardized communication tools. We have done last time the SBAS and the ISBAS. So use structured communication frameworks like the SBAS. It will help you. That is situation, background assessment, and recommendation to improve clarity in patient handovers. These are also part of what good communication. Ensure consistent documentation to reduce misinterpretation. So a nurse handing over a critical patient uses the SBAR format to ensure the next shift receive all the necessary details without miscommunication. Encourages constructive feedback and conflict resolution strategies. So you need to provide timely, respectful, and solution-focused feedback to improve performance. So as strategies, you can train staff in conflict resolution techniques to address misunderstanding professionally. You promote a team-based approach in resolving issues or problems. So instead of criticizing a colleague for a mistake, and let's provide what else. We have done constructive criticism last week. So we did constructive criticism and effective feedback. So let's provide constructive feedback and suggest ways to improve in the future. And you know what constructive criticism means and positive feedback also means. Use clear and concise language. Be concise. Vague language is not good. And the patient or the relative will not be there to understand your medical term. So avoid medical jargon when speaking with patients and families. Provide step-by-step explanation to ensure these are all to be learned. Don't say we are overload. We have so much patience, so we don't have time. That will not help. So good communicate the skills. What are some of the skills that you can use to solve all these problems? So provide step-by-step explanations. Don't be hurried to ensure understanding. So confirm comprehension by asking the listener to repeat people. What did I say to you in connection with the medication that I talk about, education on medication? What did I say you should? When do you want to take the medicine? When are you taking the medicine? I said morning, afternoon, and evening. But If you say morning, afternoon, and evening, morning, it is 6 a.m. to 11. So the date need to specific. Okay, 6 a.m. before meals or after meals. Then this. So that is how it's supposed to be. So confirm comprehension by asking the listener to repeat key points. So teach back methods. So instead of saying you have congestive heart failure and need to monitor sodium intake, and nurse explain you have a condition where your heart is difficulty pumping. So reducing salt intake in your diet helps prevent swelling and shortness of breath. So that is use clear and concise language. You need to leverage technology for effective communication. So you can have some apps. So use secure apps, messaging apps for real-time communication among health providers. Implement telemedicine. We talked about it last time. Yeah. For consultations and patient education. Provide virtual training and webinars, and we are doing it. So when you go for these webinars and workshops and trainings, don't take them for granted. Utilize them. So a hospital uses a mobile app that allows nurses and doctors to communicate urgent patient updates in real time. Train staff in non-verbal communication. You maintain positive body language, so open posture, eye contact, to convey professionalism and empathy. Then be mindful of tone of voice to prevent misunderstanding. Sometimes when you don't take care, patient will misinterpret it as maybe you are shouting on them. So be careful with the tone of voice when you are communicating with our patients. Recognize cultural differences in gesture and expressions to avoid misinterpretation. And nurse noticing a patient's anxiety, adopt a calm tone. Yeah, reassuring feature. So don't talk back if you see that the patient is also patient is aggressive. So you, as a nurse, you also need to adopt a calm tone, reassuring facial expression and gentle touch to provide comfort. So how do we develop therapeutic communication skills itself? So essential communication skills. Basically, these are the types of communication skills that we have. We have conversation skills, verbal skills and nonverbal skills, listening skills, reading skills, writing skills, speaking and presentation skills, and visual communications and assertive communications. So these are the examples of communication skills that we have. So what is conversation skills? That is the ability to engage in mindful, meaningful, and effective verbal exchange with others, fostering trust and rapport. So, for example, a nurse engaging in a small talk with a patient about their hobbies before discussing their treatment plan. So they are having conversation first, and it can lead to the main thing that you want. Okay, so as I said, a nurse was engaging in a small talk with the patient about their hobbies before discussing their treatment plan, making the patient feel comfortable, feel involved before you go to the actual thing. You can start with a rapport. Yes, that is conversation. Practice active. So these are the tips for improving conversational skills in healthcare. So you need to practice active. As I said, sometimes it is naturally, but also has to take steps in practicing them. So practice active listening. Give patient colleagues and supervisors your full attention. You can use phrases like, "Oh, understand, I got it. This, can you tell me more about that? I got it. I did, yes," to show engagement. Avoid interrupting and let the speaker finish before responding. Then ask clear and open-ended questions. Instead of, are you feeling better? Ask, can you describe how you are feeling today? That is open-ended, so that you can have more room for more conversation, for bringing up more issues or problems. But if you say, are you feeling better? It is not, it is close-ended. Yes, I'm fine. So you can't get any more information. So you can ask open-ended, so you can give room for bringing a lot of issues in there. So it helps gather more information and encourage open discussions and communication. Use simple and clear language. Avoid medical jargon, as I said earlier, when speaking to patients, because patient is not part of your field. So they will not understand your language. So that is not good communication skills. Break down complex ideas into easy to understand explanations. And you need to check for understanding by asking, does that make sense to you? Have you gotten whatever I'm saying? Are you okay? Do you need any explanation, any clarification? And be mindful of non-verbal communication. You need to maintain eye contact to show attentiveness, but sometimes too, the cultural implications on the eye contact. Use open body language to appear approachable and professional. Be aware of your tone and your facial expression, ensuring they match your words. So incongruence and congruence, facial communication or nonverbal communication. Your whatever you say must also match with your nonverbal communication. You are smiling, even though, and you are talking about what? Anger, then you are smiling. It doesn't match. Show empathy and compassion. Use reassuring phrases like, I understand this may be difficult for you. Acknowledge emotions by saying, that sounds frustrating. How can I help? Adapt communication to different audiences. Adjust your approach when speaking with patients, approach when speaking with your family, approach when speaking with patient families, doctors, or even your peers. That is your fellow nurses. For elderly patients, you need to speak slowly so that they can understand and hear and understand what you are saying and clearly. Don't be vague. With our colleagues, maintain professionalism while fostering teamwork. You also need to handle difficult conversation professionally. So stay calm and composed when discussing sensitive topics. So sometimes, even when we are even going for information or research, whatever, some topics are sensitive, and it should be conversational. How are you going to go about this sensitive topic? Because if you don't handle it well, you will not get whatever you want. So you need to stay calm, composed when discussing sensitive. Think well. So that is why I said you need to learn. Use the S-bar. Then address conflicts privately. And also, you see, last time when we were doing feedback and constructive, I said in constructive criticism, people will want or will embrace criticism when it is done in private. But sometimes also, people will also embrace positive feedback when it's done in public, so that people also know and learn. So use feedback to improve communication. So ask colleagues or mentors for constructive feedback. Self-reflect on interactions to identify areas for improvement. Stay positive and confident. So whenever you are in even high pressure situation, when you see the environment is toxic, but need to maintain your calm, maintain a positive and reassuring tone. Confidence in your speech helps build trust with patients and co-workers. Know when to pause and when to listen. Sometimes silencing is also a method of what? Communication. So silencing allows patient or colleague to gather their thoughts. So when they're able to gather their thoughts, they will come in and do the needful. Resist the urge to fill every silence. Give others time to respond. So what are verbal? After for conversations, so then we also go to the verbal and non-verbal communication, the skills. We have done it already. So what are the necessary skills? What are the necessary skills for verbal and verbal communication? Verbal skills, you know what verbal skills, but effective articulating thoughts, instructions, and emotions to ensure clarity in patient interactions. Example, what? A midwife clearly what? Explaining the stages of labor to expectant mother, ensuring she understands what to expect. A nurse explaining the lifestyle modification for a patient with what? Diabetes and hypertension. With the nonverbal skills, using gestures, facial expressions, and body language to complement your verbal messages and enhance understanding. Example is what? A nurse maintaining eye contact and nodding while what? A patient expresses concern about their condition, showing attentiveness and empathy. So what about listening skills? That is actively what? Paying attention. You're giving all your all, showing empathy and providing feedback to demonstrate understanding. And next, paraphrasing a patient's symptoms before responding, ensuring they fully understand the patient was concerned. So it is more than just hearing. It is the giving of what? Thoughtful attention to another person whilst they are speaking without what? Interrupting. If you do that, you miss a key point. So listening is a skill that involves both what? Hearing and interpreting what the others say. So when you don't give it up your all, when you don't listen, give it all your full attention, as I said, you missed points, very crucial, important points. How do we develop active listening skills? You need to maintain what? Eye contact and open body. So active listening, we have done this already, is an essential skill in healthcare and workplace settings. Well, it fosters better understanding, it reduces errors, and improving relationships. So these are some of the skills. You maintain eye contact and open body language, you know it. Give verbal and non-verbal cues. Use small verbal acknowledgements like I see, go on, I got it. That makes sense. Yeah. So nodding and leaning slightly forward can show you are engaged. Match your facial expression with conversation tone. It should match, congruence. Avoid interrupting, paraphrase and summarize. So restate what you heard to confirm understanding of the conversation. So what they are saying is, then you mean that, yes, I'm saying this, this, and this, and this. Let me make sure I understand correctly. This helps prevent what? Misinterpretations, errors, and reassures what? The speaker. You also need to ask clarifying questions, seek clarification to avoid assumptions. Can you elaborate on that? What do you mean by saying this? So open-ended questions encourage deeper discussions. We minimize internal distractions, phone calls. phone calls, visitors, and all those things. So stay present and focus on the speaker's words. Avoid formulating your response while the other person is still talking. Then practice mindfulness to enhance communication. Show empathy and emotional awareness. Then provide constructive feedback. I know what constructive feedback is about. Practice silence and reflection. Then engage in active listening exercises like role-playing, listening tests, and daily application of whatever you have heard. So make a habit of applying active listening in a daily conversation. So these are the symptoms of not listening. So if you are not listening, what are the symptoms that show that you are not listening? The disease of not listening, the I hear what you say response, but you are not listening, but you want to respond that I hear what you are saying, even though you were not listening. It exhibits selective listening is so these are the symptoms. Selective listening is what? Habit forming. This part is, I'm not interested. Let me focus on this. Let me focus on this. It is not good. The constant interrupter is not listening, but planning his or her own words. Next interruption. Maybe you want to leave, you want to just leave the conversation. So you always interrupt you so that you finish well or whatever. The daydreamer is not also listening. The poor listener is easily distracted by external factors. The lazy listener makes no efforts. Yes. Makes no efforts with difficult information. Then the signs of a good listener. So the tall signs of a good listener is paying close attention to others when they are talking, taking an interest in someone you meet for the first time, trying to find an area of mutual interest, believing everyone has something of value to teach or impart to you. So these are what the signs of a good listener. You know that this thing that you are going to have will help. So you give in your all. Setting aside a person's personality or voice in order to concentrate on what they know. Be curious in people, ideas, and things. Encourage a speaker with NURS or eye contact. Then take notes. So these are the attributes of listening skills. Being willing to listen, clearly hearing the message, interpreting the meaning of the speaker's message, then evaluating it carefully. So suspend judgment at first, but then assessing the value and usefulness of the conversation. Then you need to respond appropriately. Remember, communication, as I said, is a two-way conversation, but do your best and not interrupt, but you come in when it is appropriate. So in active listening, these are the outcomes. You establish a rapport, so expression of genuine concern, communication of your ideas, the intentions to assist in problem solving, promotion of what comfort level, then decreased level of anxiety, clients empowerment of self-care, and it facilitates learning. So these are the outcome of what? Active listening. When you give in your all, it will result in this. So these are the non-verbal behaviors of active listening. I said non-verbal behavior involve what? Active listening. So to listen actively is to be what? Attentive to what the client is saying, or the client family, what the doctor is saying, what the nurse is saying. So both verbally and non-verbally. And these are the behaviors. So these are the acronym for active listening. So XSOLA. So we have formed this acronym skill for what? Listening, active listening. SOLA is what? Sits. S is sit squarely facing the client. O means what? Observe an open posture and lean forward towards the client. E means establish eye contact. R means what? Relax. So that is the acronym for nonverbal behavior of what? Active listening. That is acronym. We have the SOLA. And so these are some of the techniques that we can use to improve listening skills. We have the paraphrasing, ask open, or we have done this one already, ask specific probing questions, use short verbal affirmations, display empathy, share similar experiences, and recall previously shared information, listen for themes in the patient conversation or comments, and act appropriately. And then non-verbal active listening, we can have nod. Yes, but it can show that when you nod, it means that you are enjoying, you are listening, and giving up your all. Smiling, avoid distracted movements, maintain eye contact, maintain good body posture, and the use of touch. So how can we become an active listener? You need to set the stage, ensure mutual words. So you need to know the person's name, prepare the place. So setting the stage for whatever is going to be what's done. Ensure you understand yourself. So mutual understanding. You take consideration effective words into consideration. Effective listening is very important here. Focus on speaking requirements. We go through the speaking thing. Understand body language and suspend all judgment to listen actively. So these are some of the benefits of being active listener. It helps you build connections. It helps you build trust. It helps you build your trust. It helps you identify and solve problems. Then it helps you increase your knowledge and understanding of various topics. And it helps you avoid missing critical information, key points. So that is active listening. So these are the listening model by Boynton. Boynton suggests that using a listening model such as the JRRR, greetings, respectful listening, review, recommend, or request more information and reward is especially what's helpful in organizations where disruptive behavior, toxic environment, and power struggles interfere with listening. So if you have this kind of what model, it helps you to improve your listening skills when you are in this environment that is not what's encouraging. So in the greeting stage, the G, a simple, respectful what greeting. Greeting is offered to establish what a professional dialogue. Then respectful what next participants demonstrate respectful listening by giving each other time to think and transmit critical information without interrupting. Then with the R, review. It occurs when the speaker summarizes the information he has conveyed to make sure that the message was understood correctly. So when the speaker is finished conveying this summary and the other party has understand or validate or clarified it, the listener has enough information to recommend the R, the next R, or request more information, the other R. And the rewards, it's recognized that a collaborative word exchange has occurred by offering thanks. That is reward. So we need to greet. So offer greetings and establish positive environment. Respectful listening. Listen without interrupting and pause to allow others to think. Then you review, summarize, message to make sure it was heard accurately. Then recommend or request, seek additional information as necessary. Then rewards, recognize that a collaborative exchange has occurred by offering thanks. So that is the listening model when it's particularly useful in a toxic environment. Disruptive behavior and power struggles. Okay, so this is the examples of what the JRR listening to. And these are the barriers to effective listening. So behaviors that hinder. So it's when you're acting distractively. Sometimes you look at your word, you are making noise, it is time. So these are the barriers. Tell your own story that's acknowledging this. Give no response. Invalidate response or begin negative. Interrupting. Criticizing others and diagnose what you said. Even though maybe the person does not mean what you said, but you are giving it a different meaning. So writing skills is this. What is it? What is writing skills? So writing skills, communication is the act of what? Writing, typing, or printing symbols like letters and numbers to convey information. So that is, it can also be said that what the ability to accurately document patient information, treatment plans, and professional reports. That is what we mostly document in our nursing documentation. So writing is commonly used to share what information. Through our books, we write. Through our pamphlets, we write. Blogs, we write. letters, memos, and what more. So emails and chat are what a common forms of what written communication these days, and even WhatsApps. So they are written communication. They are those necessary to get your point across in writing. So example, a nurse documenting a patient vital signs and progress notes accurately in the medical record that is written. So these are the key strategies for improving written skills. So it should be clear and concise, as we all know already. Jargons, people doesn't understand our language, so avoid jargons and overly complex language. Use simple, direct. Sentences. So rewrite wordy statements into concise sentences. That is your activity that you're supposed to do. Then grammar, spelling, and what punctuation. Be careful; it can change the meaning altogether. So your grammar, especially even your spelling and punctuation. So common errors in what professional writing, it is not good. It can change the meaning and what you want to express. Importance of proofreading is very important. So that is why sometimes in the end, not sometimes, in every research, in every publication, say go to the proofreading. If you want assistance, we are here to help you. So it's about your language, it is about your spelling, your grammar. So this is activity for you. Identify and correct grammar spelling mistake in sample tests. Logical organization of the content. You structure the documents, emails, and reports. So important of using headings, bullets, and numbering or theme so that you can get your message across. Then adapt tone and style for different audiences. So you need to know when it is formal, when it is also not formal. And when you establish them, then you need to establish professional etiquettes in emails and reports. So these are some of the practical applications of what's written communication. So A, you write professional emails. So when you're writing professional emails, you need to get the subject line. You also need to get the salutation, then the body and the closing. Yes. Email etiquette in healthcare settings. So activity, you can draft and critique professional emails. If you have your emails, can you do that? Avoiding ambiguity and misinterpretation. So avoid ambiguity and misinterpretation using specific and concise language. Provide clear instructions and deadlines. You also need to review and edit your documents before you send it wherever you want to send it. So you checklist for self-editing. They also know the importance of what peer review so that they can pinpoint wherever you have made mistakes or what. So proofreading and improving a sample document, if you have it, it's an activity for you. All I'm saying is an activity for you. You can do it later. And these are the guidelines of writing a report. This man, Churchill, has these guidelines for us. So when you are writing a report, you need to set out your main points in series of short press paragraphs, as I said earlier. Complicated factors or statistical should be formed the appendix. So as you know, in your research, see appendix for this. Consider submitting headings only to be expanded orally. Then avoiding woolly phrases, opting for conversational phrases. Set out points concisely. It aids in clear thinking. So these are the pros, the disadvantage of written communication. You can send out what? So these are the advantages, pros, there's the advantage. And we have the cons, the disadvantage. So you can send out what bulk message in a uniform, consistent manner. It's an advantage of written communication. You have a record of what your own communication. Yes, it is there when you want to, unless you delete it. But if you don't delete it, it is there for you. You can organize long thought process or otherwise lengthy messages. You can review what you have written before it is sent out. Yes. Then it is helpful because it provides a record of what information for references. And these are the disadvantages. It can take longer to write out and proofread a message than it cannot simply verbalize it in the first place. Motion, sarcasm, and jokes can be easily misunderstood. Yeah. Many people consider it too formal or too formal as the case may be. Your audience may sometimes read into it that you didn't intend to. Maybe they might not understand a particular phrase that you have written. So they may read meaning into it. Your skill level might give the wrong impression to your audience. And so these are some of the tips for avoiding misunderstandings in written communication. Don't use slang words. Don't use slang words or words that have different meanings within different cultures. Don't rely on your emotions. Always proofread something before you send it or deliver it. Be short and go straight to the point. Take the time to consider how your message is organized. Don't use comparisons or figures of speech in business writing. Show respect for the recipient of your message. Now let's go to reading skills. What is it? Reading skills. That is the ability to interpret medical records. That is reading skills. Patient histories and research materials to enhance decision making. So I'm advised reviewing a patient's medical history before administering care to understand past complications. So good reading is listening in action. A good reader will try to work past poor strata. He doesn't care. Boring style, doesn't care. Off-putting tone, too much or too little information, difficult to follow content, inordinate length, and lack of illustrations or diagrams. But reading techniques, you need to be clear about your purpose of reading any piece of writing. So when you are writing a research, you encourage you to any piece of thing that's piece of thing that you come across. Read it. Read everything. You get something new from it. So have questions in mind when you are reading. Keep the question firmly in mind and seek answers to them. After reading, read for main ideas, main themes, test the evidence, explanations, and conclusions critically. Make notes as you progress. Test the writer's experience against your own. Consider whether or not to reread. Discuss the material with others if appropriate and reflect on what has been read. What is speaking? Speaking and presentation skills. So speaking and presentation skills is what the ability to communicate clearly in meetings, patient education, sections, and what? Healthcare conferences. That is speaking, and you are presenting. So I can remember when I was presenting my research and abstracts when we had a conference. It is not easy. You have been in front of people, but you need practice. So I had to practice, even though I am familiar with what I'm presenting. No, I didn't sleep. When it came for the time for presentation, you see, but you have to overcome the fear and be confident and bold. When you understand what you are reading, when you know your work, So that is how it is. So, for example, healthcare provider delivering an educational section towards pregnant women on proper nutrition and prenatal care. But one, two, you need to know your staff. So speaking hints. So ask listener if they are following your messages. Give receiver chance to comment or ask questions. Clarify and look at the receiver. You vary your tone and the pace at which you go. Then avoid ambiguity and note signs of confusion. Then, as I said earlier, incongruence is not good. Make sure your words match your messages, your tone, and the body language. And these are the 6 principles of effective speaking. Be clear, prepare when you on the day. Be simple, be vivid, and what? Be natural and be concise. So as I said, the presentation skills, the reading skills are this. The speaking skills need to be concise, but the presentation skill is what? These are the cluster which form the main element of good, effective presentation skills. When you are going to present, you profile the occasion, so you know where you are going to do the presentation. So know the profile, know the area, know the environment, know the audience, those that are going to present. Are they students? Are they professionals? Are they whatever? So you also know the audience and the location. Plan and write your presentation. Even though you know you are conversant, but plan and practice. You can also use visual aids. Prepare your talk very well. Prepare your talk. So you need to prepare so that on the day of the presentation, you will not find yourself wanting. Rehearse with others, then ensure good presentation on the day of delivery. So that is the presentation skills. So these are the 7 tips for presentation success. Believe you can be successful at it. Remember, everyone, we have our first few presentation or speeches, and you by all means fumble, fear, but put them aside. When you know you have practiced, when you know your stuff, you can say to yourself, I can do it. So have the I can do it spirit. Know your topic and material. So if you know it, and when they ask you a question, you know areas, you know it, so you can answer. You don't fumble. So change your nervous energy into what? Enthusiasm. Ask those you trust for what? Evaluations after it has been done. Participate in course specifically tailored to improve this communication skill. But you can also watch public figures as they'll do their presentation, learn from their mentors and others during their presentation, watch from them. Then you can also learn. What is visual communication? Visual communication skill. What is it? So the use of charts, diagrams, and images to support verbal explanations and enhance understanding. So visual communication is the art of what? Using photographs, arts, drawings, sketches, charts, and graphs to convey information. Sometimes during our presentation, we use the visual aids and all those things. So the visual use as an aid. So visual aids during presentation to provide helpful context alongside written or non-verbal. So sometimes the visual also helps interpret whatever you want to say. So a nurse using an illustrated pain scale to help a patient describe their level of pain. When you're even educating the patient, we advise that we have a leaflet and all those things. So these are the steps for developing your visual communication skills. Ask others before including the visuals. Consider your audience before you put the visuals. You cannot put anything that is in there. Set personal goals to work through the things you want to accomplish step by step. Commit to follow up. Know your listener. So these are the guidelines to consider when you are representing as a nurse educator yourself or your clinical area. Stay less, be precise, and be vivid. Know when to speak, make consultations, ask for feedback. be positive and constructive. Then define clearly economic and patient outcome issues. Then, so from speaking and presentation skills, we go to assertiveness skills. And we know what assertive means. The ability to express opinions and set boundaries confidently while maintaining respect and professionalism. That is, example is a midwife confidently but respectfully advocating for a patient's pain relief when a physician is hesitant to prescribe what? Medication. And so these are the basic components. Having empathy, describing one's feelings or the situation, clarifying one's expectations, and anticipating consequences. The characteristics of the assertiveness self-presentation. The person, the nurse, is confident and use open body posture. He or she also uses what? Eye contact, uses of what? Clear, concise eyes. You know what? An assertive. Not use statement, but I statement. The ability to share honestly one's thoughts, feelings, and emotions. So these are the characteristics of assertive nurses' attitude towards work. So with assertiveness, so his or her what attitudes, the person can work to capacity with or without what supervision. That is assertive personness. His or her attitude towards work. Yes. The ability to, I can't remember, there was this situation when I was supposed to work with nurse assistant, and this nurse assistant did not come to work. But I was able to do my best as an assertiveness. The ability to remain calm under what supervision, assertiveness, the freedom to ask for help when necessary, the ability to give and accept compliments. And the last one is what? Honesty in admitting honesty in admitting mistakes and taking responsibility for them. So what is interview skills? Interview skills. So another situation in which communication skills are important is what? The interview skills, gathering information and interview. And interview, is a structured conversation with a specific purpose. So the primary purpose of an interview is to obtain accurate and thorough information. So in nursing, the interview is a major tool for collecting data during the assessment steps of the nursing process. So these are the types of interview, formal and informal. And both informal and formal interviews seek information about what? Patient past history, yes, health history, patient current consent, level of understanding about health and current problems, and care and assistance desire. These are the still interviews, the formal interview. So the formal interview is usually longer and more structured, yes, than the informal interviews. And as nurses, nurse educators, we frequently use printed form. We can also have checklists or outline that may consist of topic and headings. And this approach seeks to guarantee a complete and comprehensive data collection. So these are the effective interview. You need to establish a verbal contract with the patient, sit at patient level, make the setting as private and as free from what distractions as possible. Attend to patients' immediate physical needs before expecting them to focus on the interview. Vary the approach and formats to meet patient needs. Balance the use of direct and open-ended questions depending on the type of information source. Then collect only data that are not available elsewhere. So that is all. So these are the interview techniques. We have closed-ended, open-ended, validating question, clarifying, reflective, sequencing, directing questions. So these are the types of what interview or interview techniques that we have. So during interview, you need to prepare, be consistent with your questions, be conversational, ask appropriate questions, look for real solutions, make the candidates more comfortable, listen for non-verbal language, and be flexible. These are the techniques. Thank you for listening. The light is off. So I was rushing, sorry. But my data was about to finish and we have light off and my phone was about to also close. So do you have any question? As my computer is about to what? Off. So what I have discussed is, hello, Christopher or whoever. You know what? Since Friday is holiday, can we do the midterm on Sunday? As I also scheduled the year 4. So we can do the hello, are you there, classroom?
Yeah,
hello.
madam.
Yes,
Hello, madam.
so we can, yes, since Friday is holiday, we can do the midterm on Sunday, right? Okay.
Okay, madam, we will give you the feedback. We want to start with the...
No, if you don't do it, it's go against you. So let's do it. Either Thursday or Sunday. So you choose one. And give us the time. So that we set it. Otherwise,
Okay.
if you say next week, we'll have more. I have about 2 or 3 topics that I have to treat. And you know, we have also another Friday that is Good Friday. So let's compromise. Let's come to a compromise and do it on either Thursday or Friday. So let me know because I'm sending it to the IT people. So they need the time for year 4. It is first Sunday. So if you can do it on Thursday or Friday, let me know quickly. Decide and let me know. Okay.
Right, madam.
Okay. So I will be waiting. And thanks for your concern and thanks for everything.
Welcome, madam.
Good. Yeah.
Thank you very much.
Okay, you're welcome.